Hello everyone. Today we will like to welcome Dr. Abhinay Anand, rank 34. So first of all, congratulations.
Thank you so much, sir.
Okay. कैसा लग रहा है? How are you feeling now?
I said this is a very different feeling. I mean, first time when I saw the result, I could not believe myself कि इतना अच्छा रहा. But then I again saw the result and it was like, yes, I did it, and a very big role of DAMS was there in my success. So very thank you to all of you.
Okay. So parents भी काफी खुश हो रहे होंगे?
Yes, sir, definitely.
गुड. तो अब अपने बारे में हमें कुछ बताओ. तो स्टार्टिंग फ्रॉम की यू आर ए स्टूडेंट फ्रॉम विच मेडिकल कॉलेज?
Sir, I am from Institute of Medical Sciences, Banaras Hindu University, Varanasi.
ओके, वाराणसी. ग्रेट. सो आपने कब से स्टार्ट किया, मतलब कि ये जो नीट पीजी की तैयारी है, व्हेन डिड यू स्टार्ट?
Sir, I started from my second year, because in the first year when we came here, everyone said that yes, you have to start preparing early. And at that time, the first choice of everyone was like, go for DAMS. So I started with my pre-foundation courses, satellite courses in Varanasi itself. Then I completed my pre-foundation in second year. Then I joined the foundation batch in third year. And due to COVID, we did the satellite classes in which all of you taught us all the topics in so much detail. Even your diabetes notes, whenever we read, even now when we read, it is like complete diabetes in itself. So like that, in the foundation course, I completed all my 19 subjects in third year itself. And
great. So that means कि you were serious from the beginning. You were very disciplined from the beginning. And
yes,
you prepare your notes, pre-foundation notes also, first year, second year?
Yes, sir.
Okay.
All notes are prepared by hand, and in third year itself, I completed. Due to lockdown, we were at our homes, so at that time we got a very good opportunity to complete all the subjects through the classes. So I completed all my 19 subject notes in third year itself, and then in final year I took the TND course, through which I revised. Then in internship I again took the TND course, so I did the TND twice in final year, then again in internship.
Okay, so that means कि you must have done multiple revision of your notes.
Yes, sir. Once when you taught at that time itself on the same day or the next day, then during third year once again, so twice in third year, then 2 to 3 times in final year, then 2 times again in internship. So around 4 to 5 revisions I have done for each and every subject.
Great. That's quite a disciplined preparation that you did. All right. So, and what about, have you given GTs, mock test and CBTs?
Yes, sir. I gave CBT 2 and 3, which were for NEET. I gave all the GTs, and CBT 2 was so much similar to the final exam which we saw. It gave so much like a full-on experience that how we are going to have the exam, what type of questions are going to be there. And every time you said, all the teachers said that topics are repeated. We saw that in a single exam itself, the topic was repeated multiple times. I still remember one question on Wernicke's encephalopathy. Once they asked the symptoms, then they asked the diagnosis. Same question was given twice. So definitely the DVT, the PYQ, they were the base on which we went for the exam, and definitely everything came mostly from that only.
Yeah, and I can remember that in February GT, there was a question on Wernicke's.
Yes, sir. Yes, sir, definitely. And in the last 15 days, I did only the PYQs, which all the teachers discussed, because my internship is also going on. So simultaneously, I have to go for the internship and prepare also. So whatever time I had, I invested in DVT and PYQs in the last 15 days and nothing else. All the notes I had already revised twice or thrice previously. So I thought, no, in the end, I should go for something concise, which is doable, which is a doable target.
Doable. Yeah. Most important word is the doable word. Okay. Yes. So I got so many queries from the student, like how to prepare during internship, because internship is hectic. Indeed, in BHU, it must be very heavy internship. So can you tell us कैसे तैयारी करी during internship? How were you able to manage the duties with your studies?
Sir, I made my, you can say, the timetable in the beginning itself. I saw in the beginning only, okay, for the next 1 year, which are the postings in which I can get more time, which are the postings which will be hectic. So I planned accordingly. Like if I am having a not very hectic posting, then I planned for bigger subjects like medicine or surgery in that duration. And if I had some hectic postings like general medicine ward postings or emergency postings, in that I planned short subjects like optha, ENT, which I can do small bits, 3 hours, 4 hours every day, and in a week or 10 days I can complete those.
Yeah. So Yeah. So that means ki during your heavy duties in medicine or surgery, you should go for a lighter subject revision. And during your light posting, you should go for a medicine or surgery big subject revision. So that is quite a very useful tips from your side. And what about the MCQs during the internship? Means ki you used to do MCQ practice in the duty hours or after your duty hours?
I know, sir. Mostly during the duty hours, I used to do whatever time I got, 10 minutes, 15 minutes, I used to do MCQ in that. And whatever time I had after the duty hours, I utilized them for revising the notes or for studying only, not for MCQs mostly.
Okay, fine. And how many GTs you have given?
Sir, I gave a total of 10 GTs. 10 GTs. And apart from that, 2 CBTs I gave. So total 12.
Okay, and your score would be around in those GTs?
Sir, in GTs, my score was around 600, mostly 600, less than that. So I was also a bit surprised when I got 690 in the final exam.
Okay.
But they were a very good simulation, I must say.
Simulation, okay. And what about the CBT ranks, your CBT ranks?
In the first CBT, I got rank 88. So it was the closest I had to my
closest, okay.
Yes, and in CBT 3, I had my rank 300.
300. Okay. Now coming to the exam day. So during the exam day, what were your feelings? You were anxious, you were confident, or?
Sir, actually, 1 week before the exam, I took leave from my internship and I used to give 1 GT every alternate day.
Okay.
So when I went for the exam, it was like I'm going for another GT only. So it was like I was not feeling very much anxious. Yes, it is a big exam, but I took it like, yes, I'm going to give just another GT like I used to give 2-3 days before. And I went with that mindset only. And when I saw the questions, although we say that NEETPG is going towards clinical, but this year there were many questions that were simply one-liners. So most of the things were like, yes, Arvind sir taught this, or Deepak sir taught this, Deepti ma'am taught this. So they were like, instantly we got the answer. So the exam was good. I attempted all the questions, 200 questions, because Sumer sir used to say that you have to be aggressive in the final exam. So I thought of leaving 1 or 2 questions, but then I thought, no, I should go for all the questions. So I attempted all 200 questions and it was a good experience.
Okay. And how was the exam? Was it a moderate or was it a difficult type of exam?
Sir, I would say that the exam was in the segment of easy to moderate, because what happened, many questions were asked from the same topic. Like we had 2 questions directly on autopsy techniques. 2 questions, Rokitansky and Letiur. They directly asked, means directly, if you know the answer, you know the answer. If you don't know, you don't know the answer. For those who have read the topic, and there were many similar topics, like many questions were from the same topic. So those who have read, even they have read the DVT or they have seen the PYQs, for them the exam is easy to moderate. But for those who have not seen the papers or not revised the DVT, for them it is going to be a bit difficult paper.
Okay, so what I can understand, and that for our audience also, the best way for preparing the NEET-PG exam is to build your basic, be disciplined from the beginning, make your notes on the in the same year. Do not postpone making your notes or revising your notes for a later date. And also you should give a continuous grand test in between, and in the end revision is most important. And because of lack of time, previous year question, PYQs and DVT, that will be very handy.
Yes, sir, definitely. PYQ and DVT, I will say, are like the gold which you can get in the end, because in the end it is not possible to revise the entire notes of a particular subject. So at that time, whatever flow charts you gave in the DVT or whatever flow charts you gave in the class, like jaundice or anemia, whatever was there, we only revised the flow charts, we went with the PYQs, and everything was like, yes, this was discussed, this was discussed. So everything was from whatever we have discussed in the class.
Oh, great. Awesome. And this is quite a very good rank. And those for our audience, I am with Dr. Abhimanyu. He has secured rank 34 in this NEET year PG. Now tell me, suppose I'm a very average student or a below average student, and now I'm starting to prepare for my NEET PG. What 2 advice or 2 cents you will give to me? What should I do?
Sir, first and the foremost thing I would like to say is we have to be consistent. consistency is the only thing, because every time we will have time issues or anything will be there, because we are medicos, we have to manage everything. So the only thing is consistency. Even if you study for 2 hours or 3 hours a day, it is fine, but you have to give your best in those 2 to 3 hours. And the second most important thing which I felt in all these years of preparation was the live classes. There is no comparison of live classes. Many people say that we like recorded classes because it gives us the ease or it gives us the freedom, but that freedom, we misutilize that freedom. So it is better to go for live classes. In that we will be disciplined, we will be forced to complete the topics on time because we have to do it live with the teachers. So these two things I think are the must: consistency and secondly live classes.
Yeah, golden words, key consistency and disciplined preparation, because freedom will not give you discipline. That discipline which is needed to crack the NEETPG exam. Yeah. Yes. All right. So now tell me, so because your exams are over, you have secured such a good rank, what are you planning to take as a PG course?
Sir, since final year, my only goal was to take general medicine. And most means the biggest inspiration I would say is you. The way you taught the topics in the class in general medicine, it was like, I want to become like Arvind sir and Srinath sir. Both of you teach in such a simplified way. You explain the topics in such a simplified way. So my goal was to take general medicine, and definitely I'll go for general medicine only.
Great. Awesome. So now finally, like every medical student have some phases where there is an element of, say, saturation, some element of anxiety or depression. So you must have gone through that phases, temporary phases also. So how were you able to move out from those phases and be on track?
Sir, as I said, I mostly maintain discipline. Like, okay, even if I don't want to study, I take a subject which I have studied earlier. I study those subjects in which I'm good, because they will give me the confidence that, yes, I know these things, I can do these things. So whenever I felt like that it is too much saturated, I went for those subjects or those topics in which I was good. So that when I did those subjects again, I was like, okay, now I can proceed for the subjects which I do not like much or in which I do not have that much confidence. So that was the thing which I used to do, that whenever there was saturation, I went for the good subjects, which I feel good subjects, which I used to study at that time.
Okay, so that means that you maintained a rhythm throughout your preparations.
Yes, throughout my internship, throughout my final year, I did not skip the things. I mostly used to like go on with it, even if you don't want. थोड़ा थोड़ा करते हैं, धीरे धीरे हो ही जाएगा.
Okay, so good. So your advice to the future PG aspirants?
Sir, my only advice would be start to prepare early, because now the competition is becoming very fierce. Like people are getting even much better marks. So start preparing early and be consistent with your source. Whatever source you are using, stick to that. Have faith in that, because I see many students like switching from this to this, then this to this, then this to this. We should not do that. Whatever we are choosing, we should stick with that, and we should be consistent, and we should be honest to ourselves that, yes, if I'm doing something, I should be honest to myself. That is the only thing I would like to say.
Yeah, so that's a very unbiased approach that you have given, that start preparing early and be consistent with a single source and believe in yourself.
Yes.
Yeah, great. So it was nice talking with you, and one day we'll definitely meet, maybe in career counseling. And all the very best for your future career ahead. And once again, congratulations from our side, from DAMS family side, and convey our regards to your family also.
Thank you so much, sir.
Okay.